Coming up on Lifestyle.
Maybe I'll make a YouTube video and I'll educate, I can do that without a license. Dentistry and teeth is kind of, I don't want to say sterile, but we try to make it fun. I would love to focus on floss today with the mouth. Do you brush or floss first? That's probably the number one biggest argument in the dental world, but I recommend that you use. There's other things you can do as well. There's water flossers, there's little proxy brushes. That people are so, like a teeth enthusiast like me is so cool.
Did you know one key that could totally change your life is a toothbrush? We're talking to YouTube sensation Whitney DiFoggio, who will talk with us about how this one brush could change your whole life. I'm Roy Ice. Welcome to Lifestyle Magazine.
This is Lifestyle Magazine with your host, Roy Ice, and key experts Mike Tucker, Dr. Charmaine Long, Lionel LaMountain, and Marie Mitchell.
No stranger to thousands on social media, our guest today is Whitney DiFoggio, the creator and star of Teeth Talk, a popular YouTube dental channel for patients and professionals alike. Whitney, thank you so much for coming on to Lifestyle Magazine. It's so great to have you here today.
Thank you for having me. This is exciting.
Yes, it is. Now, you started a YouTube channel about teeth. And what happened? How many subscribers do you have now?
Oh, so right now I have just over 200,000 subscribers, which is wild. Yeah, that happened.
Oh my word. So did you ever in your wildest imagination think that, okay, so I'm going to do some videos on dental hygiene and it's going to take off?
No, I never thought this would happen. I thought I would just make a video and my mom would watch. I didn't think anyone would watch. But I was waiting for my dental hygiene license to arrive in the mail. So right after I graduated from dental hygiene school, you can't practice until you have your license in hand. And I was really excited to practice. So one huge part of being a dental hygienist is patient education. So that's when I thought, maybe I'll make a YouTube video and I'll educate, I can do that without a license. So I made that video and I sent it to my mom and I was like, please watch. And then all of a sudden a lot of people watched and I was like, oh, and they were asking for more. So here we are.
So you do a bunch of different videos on things like plaque and tartar, gingivitis, even a gingivectomy. What in the world is a gingivectomy?
So yeah, there's a lot of dental words that a lot of people, they hear of and they're like, what is it? A gingivectomy is when your gums are over your teeth, so you can't see your teeth. So the gingivectomy removes part of the gum so you can visibly see your teeth better. So sometimes the gums overgrow if you're taking different medications. There's a bunch of different reasons why that might happen. But yeah, so gingivectomy is removing part of your gums because they're overgrowing.
So over 200,000 subscribers, millions of viewers. What have been some of the surprises for you, maybe on some of the topics that you videoed or some of the stories that have come back to you from people who've watched the videos?
Well, right there, that people even care what a gingivectomy is.
Yeah, seriously.
So it's pretty cool. I think my biggest surprise is that so many people are interested in caring for their teeth, and I think that's really cool, and more people are learning the connection between your teeth, your gums, and your overall health. And I think that surprised me that people care. I know a lot of people care about cosmetics, but more people are getting interested in a healthy lifestyle in general, but that people are so, like a teeth enthusiast like me is so cool. I'm happy we have this community to share and spread awareness mostly about dental hygiene and how important it is.
Absolutely, because most people that I know avoid their dentist and their dental hygienist way more than they should.
It's a hit or miss. So I've received a lot of comments where random people have said, watching your videos, they'll say they're nervous to go to the dentist, but watching their videos, my videos exposes them to what they might be nervous about. So I've had a lot of comments that say, it was really cool watching this. It gave me a little less anxiety for going to the dentist today or tomorrow. Like the comments always say things like that. And it makes me feel good that we can expose things to people that are a little nervous.
Absolutely. My wife loves going to dentists and dental hygienists that we know. They're friends of ours. I'm the opposite, and I go ahead and go because it's what we need to do to stay healthy. And we're going to talk more about that throughout this episode. But I would much rather have someone who doesn't know me have their hands inside of my mouth. There is this stigma of anxiety, of embarrassment. And so that's really cool that your videos help people with that. Did you always want to be a dental hygienist?
So I always was interested in dentistry. I really thought I wanted to be a dentist, but when I was doing my undergrad, my bachelor's degree, you had to do so many observing hours, shadowing of a dentist, which is great. I'm glad the pre-dental program did that because I always found myself not watching the dentist. I would be watching the dental hygienist. I was like,
Really?
ooh, I'm really interested in what they're doing. Yes, I found that the dental hygienist was really all about prevention, which was so cool to me. They had so much more time with their patient. They can really talk about the importance of gum disease and all these things that I never thought about, like going to my every 6-month cleanings growing up. I didn't know. So yes, so I didn't think I wanted to be a dental hygienist. But then when I found out I was more interested in dental hygiene, I never applied to dental school. I just applied to dental hygiene. And I still had in the back of my mind, I was like, maybe I'll do dental school after. Let me just see if I like this. And I never looked back. I was like, this is for me. I love the prevention aspect. It's so cool.
So how many years have you done this?
So I've been a hygienist for 6 years now.
That's awesome. But you started your videos before you even had your certification?
Yeah, so a few months more than 6 years, yeah. But the first few years of making the videos, so it was a couple months before I received my dental hygiene license. And then once I received my license, I was like ready to work. So I didn't really make the YouTube videos that much the first couple years. I was like 7 days a week almost cleaning teeth. I just loved it.
Yeah.
But something in me, like I had so much energy of wanting to talk to the camera again and tell. I have my patients one-on-one in the op, and it's great, and I love it, and I could help one patient at a time. But making the videos is so cool to be able to help more than one patient at a time.
My word, you're helping hundreds of thousands of people at the same time.
It's wild.
What's one of the videos that you've made that kind of surprised you at how much traction it got, how many views?
Probably two come to mind. One video is just cleaning someone's teeth. I couldn't believe so many people wanted to watch me just clean someone's teeth because
Yeah.
I do that all day, right? I don't think of it. But a lot of people commented like, it's so cool to see what is really happening during my cleaning. This is what you're scraping off. And that brings me to my second video is plaque versus tartar. A lot of people were very interested in plaque versus tartar, which I was happy about because I'm interested in that, but I didn't know so many others wanted to know the difference.
So what is the difference between plaque and tartar?
Glad you asked because it's my favorite thing. Plaque, so plaque is the white sticky stuff that you can just brush off. So it's usually after you eat food, you know, food debris, it turns into a plaquey substance. You can brush, you can floss. But if you miss a spot or if you don't brush or floss, it starts hardening and it mineralizes and it turns into tartar. That's the stuff that you can't brush off at home. You have to get it professionally removed by a dental provider.
So there are more things that are affected by bad tooth care than just simply having bad teeth, aren't there?
Yes. So unfortunately, gum disease puts you at an increased risk of heart disease and other oral systemic link conditions. So that link, the oral systemic link, is huge, and a lot of people aren't aware of it. They think if they have gum disease, it's just bad breath or, you know, not as pretty gums, but there's so much more to that.
Well, I want to talk a lot more about that. And when we come back, our wellness specialist, Dr. Sharmini Long, is going to join us, and we're going to talk about how caring for your teeth actually affects your whole health. So stay tuned.
I make dental videos to help people improve and maintain healthy mouths and healthy teeth. Whether you're someone who is interested in a healthy lifestyle, including your oral health, or if you're a full-out teeth enthusiast, I have videos for you. Of course, teeth are important to us because they help us talk and they help us eat. Please like and subscribe if you'd like to join the Teeth Talk community. I put out new videos.
Now, Whitney, it looks like you have so much fun making these videos.
I do. I'm very lucky to have fun. Sometimes dentistry and teeth is kind of, I don't want to say sterile, but we try to make it fun.
It's more approachable then too for people, right?
Yeah.
I, as a healthcare provider, I really appreciate what you're doing because I think that people often really underestimate that link between dental health and just their whole body health. and don't really make that connection. And it sounds like you really do that a lot on your videos.
100%. I always feel like it's really cool when physicians collaborate with the dentist or the dental hygienist and could really work together, because a lot of patients don't realize that your mouth and your gums and your teeth relate to so many other things. So it's
Absolutely.
cool to put that into a fun tone as well. You don't want to make it like too scary, but you also want it a little scary so people really do realize the big deal of it. So
And take it seriously.
yeah.
Coolest thing about your videos is you're so positive and you're so bubbly about it. It's not the standard, you got to go to the dentist, type of approach. So I've heard a ton of people just say it's so great because she just has a great personality. So it's a great combo there. But now that I've got two medical professionals here, I want to discuss here, what are some of the whole healthcare issues? Because I've heard it's not just simply about having good, strong teeth. It literally affects so many other systems of your body. So what are some of the things that you've noticed are affected outside of the mouth?
Generally, it starts with gum disease. So gum disease is an infection of your gums, and that bacteria can travel because you have little blood vessels all throughout your gums, and that can travel right to your heart. And heart disease is one of the most increased risks you have with gum disease. Alzheimer's, diabetes. A lot of people can't get cleared if they need a kidney transplant until the dentist and dental hygienist sign off and say there's no gum disease present. So there's so many things that contribute to the teeth and gums.
Wow, I never would have thought of the kidney transplant. What are you seeing, Dr. Sharmini? What are you seeing as issues in your own practice with dental care?
Sure. As an endocrinologist, we deal a lot with diabetes. So you absolutely are correct that there is a link between oral dental disease and diabetes, and that chronic inflammation and infection within the mouth can cause a lot of problems. In particular, I see with patients who have diabetes that their blood sugar is a lot worse if they don't have their teeth being taken care of. And so I'm often telling patients, this is one of the things you really need to have evaluated. If we're having trouble with blood sugar control, you should go to your dentist, make sure your teeth are clean, make sure you don't have issues there that need to be taken care of. I remember one patient in particular, he was a pretty lean guy, had type 2 diabetes anyway, and after seeing, he was on insulin, a lot of insulin, and after seeing him, I was like, you really should go and see your dentist. I think that you have some dental issues that might need to be evaluated. So he went and saw his dentist, had several teeth pulled, came back. We were actually able to take him off of his insulin and transition to just oral medications. And so it really had a huge impact on his overall health and just the care of his diabetes in getting his dental issues addressed.
That's incredible. I never would have thought an endocrinologist would have to refer a patient to a dentist to deal with.
Sure. He was so excited to come off of his insulin, like he couldn't
that's
believe it that he didn't have to do shots anymore just after getting his teeth taken care of. So
That really is amazing. What are some of the things that you're
I was going to say, if we notice any red flags, we like to refer to the physician as well. So I love that collaboration because, right, we don't have the tools to do too much with heart disease other than tell you it might be going on. And then I feel like most physician offices don't have scalers to clean the teeth. So it's kind of cool that we're able to kind of specialize and help everyone.
Absolutely. I think so often patients kind of think of this as like a separate area, and it is, right? You go see someone who's a specialist in a different area, but that oral health contributes to so many things for the whole body, and you do need to have kind of that whole body approach to things.
It's all connected, and that's another thing. A lot of patients will say, oh, it's just my teeth. And I'm like, but here's the thing, like your teeth help you talk and help you eat, and those are like the two most important things, so we need to figure this out, So it's not just teeth, they're very important. I always make the joke too that everyone's worried about cavities, which is important. It's very important to be worried about cavities, but a lot of people forget about their gums because of what we just said, the connection to all the other systemic conditions. So gums and teeth, they're both so important.
And even the link to the brain, like you mentioned with Alzheimer's, they've done studies actually introducing bacteria that causes periodontal disease into mice and seeing that it caused neuroinflammation and neurodegeneration and plaques within the brain that are similar to what we have with Alzheimer's disease. So obviously there are a lot of things that go into dementia and Alzheimer's disease that we don't fully understand at this point. But that's a huge link. And I think that that's something that I find that patients are really fearful about potentially developing later on in life. So it's actually probably a key component that you should take care of your oral health and make sure that you're staying up to date with your dentist as one of the components to try to prevent even Alzheimer's disease.
100%. And it's so easy to just brush twice a day and floss or clean between your teeth some way once a day. Like it's one of those easy things. You don't have to go on like a huge diet or a huge, like you just brush. And a lot of my patients have told me like, I really started like doing the things you told me and I'm feeling pretty good. And I'm like, yes, like wasn't that cool? Like we're all in this together.
I think that so often people don't take that into consideration. I was reading that I think it's 44% of people haven't seen their dentist in the last year or their dental hygienist in the last year. So that's a really large percentage of the population that's kind of missing that key important part of their health.
Yes.
It's especially been challenging during times of pandemic. You know, during the pandemic, people just stopped going for dental work as well. And so it's really caused quite an issue that we're probably going to see a lot of whole health issues coming up.
And with the anxiety, a lot of patients that didn't want to go to the dentist anyway, now when the dental offices were closed for a few weeks, it depends on the area, maybe a few months, when we started making appointments now, like you could come back in, it's safe, we have protocols in place. Some patients are like, no, I'm good, because like that just gives them one more reason to not want to come, which I get it. Like if you don't really love coming anyway, a pandemic on top of it,
It just adds one more fear to it. Well, when we come back, we want you to help us understand how we can definitely take care of our teeth. And so next up, Whitney is going to give us some demonstrations on how to best take care of your pearly whites. So don't miss it. We'll be right back.
Dental health is important, but so many of us neglect our teeth and gums. The worst that could happen is bad breath, right? Well, not exactly. For instance, did you know that ignoring your teeth can lead to acne? More and more evidence is linking poor dental hygiene to other health conditions, especially chronic illnesses such as heart disease, diabetes, and Alzheimer's. So maybe think twice about skipping your daily dental routine. Regular flossing and brushing will not only preserve your beautiful smile, but more importantly, keep your entire body healthy.
We're back with Whitney DiFoggio. Now, you have some stuff to demonstrate for us here. What have you got?
Yes, so I would love to focus on floss today with the mouth, but do you mind holding
Sure,
it?
sure. I have a lot of questions about flossing because
Okay.
we even have arguments amongst my friends about who's doing it right and even when they're doing it right. So we'll talk about that.
Okay, so yes. So a lot of people like to use the little picks, which is fine. It's better than nothing, but I recommend that you use the string floss because you could adapt it better to your tooth.
That's not good because those are the ones I typically use.
Which it's better than nothing, but I'll show you the reason why they're not as good usually.
All right.
So when you put it between two teeth, you just go up and down and you're good, right?
Right.
It might remove something from your teeth, but it's not cleaning these parts right here. That's so important. So if you can kind of bend it.
I try to
if you
go in
bend
there.
it, you can maybe get up in there a little bit. I don't know. It just isn't as good. But when you use real floss, you can really get up in there and then you make like a little C, and then you wrap it around the tooth, up and down to the left, up and down to the right.
So
and
you
can
really want to get into the sides up there.
Yes, these little sides are so important. And I always say though, with kids, these are probably your easiest best bet, but this, like you just saw, you can really get up in there and remove any debris. You want to go slightly under your gum. You don't want to like hurt your gum and go straight up, but on the sides, there's a natural space between your gums and your tooth, and that's what you want to clean.
These always break on me too. So I go through like 5 of them, you know.
There's other things you can do as well. There's water flossers, there's little proxy brushes, but something needs to clean in between your teeth.
My friends and I argue. I live in a medical community, and we argue about is there a right time to floss, because some people say you shouldn't floss before or after certain things. What's your viewpoint on when's the best time to floss?
Well, if we're talking about before or after brushing, do you brush or floss first? That's probably the number one biggest argument in the dental world. Because,
Really?
Yes, there's actually evidence to support both ways. Flossing first, There's good things about it that you could remove the debris, and then when you brush, there's no debris there, so nothing's
Right.
like blocking the toothpaste. But then if you brush before you floss, and that's actually what I do, is if you brush and then you have the toothpaste on your toothbrush and you spit, make sure you spit it out, but leave the toothpaste on your teeth and then you floss, you actually are getting that toothpaste up in those areas. So I kind of like that way. Other people might feel differently. As long as you're flossing, that's all we ask. I don't really care.
I hope my buddies are listening because I'm correct.
Oh, are you on that? Both are fine. Both are fine. People are always going to argue it, but as long as you're flossing, every hygienist and every dentist will agree, as long as you floss and you're doing it right with the proper technique, that's what's important.
Right. Very good. Now, some people say you can, like, depending on what type of toothbrush, a firm or a soft, whatever, that you can brush too much, or what is your advice about proper brushing?
Always soft. So you never want to hurt your gums. So if you're brushing with a hard toothbrush, you can actually brush your gums away. And sometimes you could even enamel erosion. If you're brushing too hard on your tooth, you can brush some of your enamel away, which is really not good. Most electric toothbrushes are all soft. They don't make heads that are hard or firm or medium. And always do gentle motions. And you angle it up toward your gums a little.
I use an electronic toothbrush. I got it because the box said I would remove 80% more plaque than a normal toothbrush. Do you recommend people use electric? What's your thoughts on that?
They both are effective at removing plaque as long as you use them correctly. The unfortunate thing is most people use these regular manual ones wrong. So that's why a lot of people don't do a good job with them.
So
But
how can you use that wrong?
you could just brush really hard that you're like missing, or you're missing your gums, or there's just not as much vibration. Like I'm doing these nice little circles, but with the vibrations, the electric toothbrush, they are like getting in there.
Absolutely.
So good. I feel you can't go wrong with an electric toothbrush. But if you're someone who's like, no, thank you, I just want to get this right, you can get this right.
Yeah.
But you just got to work a little harder.
Thank you so much for sharing all this with us. Very helpful for us. I hope you'll stick around because I've got a few words in closing right when we come back. Who would have thought that so much of your total body wellness could be affected by how you care for your teeth and gums? As we take a look at the 5 aware keys that help us live our best lives possible, let's take Whitney DiFoggio's advice and make our dental care a priority. It's not the most fun thing to do, but the overall effects will not only improve your wellness, but can even help you have success in all the other key areas of your life as well.
For more meaningful life tips and an opportunity to view this show and all other episodes, visit our website at lifestyle.org. Thanks for watching, and we look forward to continuing this journey with you on future episodes of Lifestyle Magazine.